Okay guys, now we're moving into the lower lung. So the first segment we're going to listen to is the posterior superior segment of the lower lobe, right? So again, we're going to be starting at the spine and scapula. It's going to kind of run to the inferior angle, right? So about T3, T4-ish to about T7. Again, in the intercostal spaces, we're not listening over the ribs. And again, depending on the patient's clothing, we may have to listen a little bit over it. If depending on the comfort level, we can maybe listen slightly under it, under the edges. We have Juliet here as our model. Thanks again, Juliet. Do I have your permission to listen here?
Yes.
Okay, great. So we're gonna be feeling around kind of around your shoulder blade, and we'll be auscultating there. So placing our scope in, giving a tap. Again, spine and scapula, inferior angle. Okay, so Juliet, can you give yourself a hug? And just breathe through your mouth. Good. Breathe through your mouth. Perfect. All right. That's posterior superior segment of the lower lobe.